Rogers, Section 2, Adult Health 1, NG2. I will verify my MAR, the right patient, the right tubing, and the purpose, which I would explain to the patient. The purpose of the NG tube is for vomiting, and it's a tube that will go from your nose to your gastric or your stomach region. I would then place the patient in high Fowler's position. I would check the nasal area and the oral cavity for any deviation or obstruction. I would ask the patient, had they had any broken noses or any trauma to their nose or mouth. Then I would measure the tubing from the tip of the nose around the ear down to the xiphoid process. Where I would tape it off just for placement. Okay. I would wash my hands, apply gloves. I would squeeze out my lubricant, put my tubing 4 inches in the lubricant. Okay, I would explain to the patient that I'm about to insert the tubing and that their head should be against the pillow, pressed against the pillow as I insert. Once I insert a little, I would ask the patient to swallow some with or without water, and then I would ask them to lean their head forward as I continue down. And a little bit before then, I will also check for any coiling. No coiling, no resistance. I will proceed to place it further down, temporarily place the tubing to the cheek so I can check for placement. I will ask the client to speak. Again, check the oral cavity. I will aspirate about 10 to 15 milliliters. Depending on the hospital's protocol, I would test the pH. Once that is done, I will listen in the left upper gastric region as I place the contents back. I hear a swooshing, or if needed, I will also request for an x-ray. Once that is done, I will remove the tape from the cheek, stabilize the tube on the nose area using the Y formation. Okay. Then I would pin the tubing to the gown, giving it some leeway so the patient is able to turn the head sideways. Okay. Once that is done, I will connect the tubing to the low intermittent suctioning. I would let the patient know to inform me if anything, any pain or discomfort, or if the tubing were to come out. I would let them know I would provide oral hygiene practice 2 to 3 hours. And once this is in place, I will document, which would be the time of insertion, the NG length, size, and type, the color or consistency of the drainage, client's response, any instructions that were given, any intake and output, the amount of drainage, if the pH was tested, what the value was, and that is it. You know what I